Hey guys, Dr. Ross here with Inver Chiropractic, and I want to give you guys some things you can do at home, especially on the nutrition side of things, to be able to fight this COVID-19 as much as we possibly can, try to increase and boost our health and improve our immunity so that if for some reason we would get it, we can try to defend it off as best as we possibly can. So a little backstory on it. One of the biggest things when it comes to how affected we are if we get infected by COVID-19 is, do we have any pre-existing conditions? And what the research is showing right now, and there's a lot of numbers that still have to come in, but people who are hospitalized, is 71% of them have one comorbidity or pre-existing condition. And if we look at the ones a step further in the ICU, 78% of them have some sort of pre-existing condition. And then I don't have the death tolls with that in the United States, but we stole it from Italy. 99% of the deaths in Italy from COVID-19 had some sort of pre-existing condition. So it's super important to be able to know if you have them, know if you're at risk, and then what things you can do to try to prevent them from having a major impact. So the big things, lung issues, cardiovascular disease, heart disease, and diabetes. Those are four big ones. We're going to focus on diabetes, heart disease, and obesity. And one way we can look at that is something called metabolic syndrome, because if you have metabolic syndrome, you might have one of those three, but then it also can increase your risk factor for having those three. So what we look at is waist circumference, triglycerides, so how much free fat floating around in the blood, HDL cholesterol, that's a good cholesterol, it helps take stuff out, and then blood pressure and glucose. And if you have high or low numbers where we don't want them in here, and especially if you have two of them, it increases your risk factors for having a coronary artery disease event such as death. And if you have four of them, it increases your risk from death from heart disease by 3.5 times. So 5 things we can quick look at are these 5, and what can we do to help combat those? Because these things lead to those pre-existing conditions, which lead to increase in death when it comes to COVID-19, what the numbers are showing right now. So what can you do at home? We know there's an issue with pre-existing conditions, so what can you do, especially nutritionally? So we want to stay away from inflammatory foods. We're going to make this as simple as we possibly can, and we want to eat anti-inflammatory foods. So we're going to go over an example of a couple of each category. Inflammatory foods, refined carbs, bread, especially white bread, pastas, anything that's bleached, pretty much everything in the middle of the store when you go to the grocery store. Shop the outer sections as much as you possibly can. French fries and fried food. Stay away from fast food. You're supposed to be staying at home. Stay out of the drive-thrus. Order something from a healthy food place that you can do pickup or DoorDash for it. But stay away from the fried foods, please. That's a big one and an easy one. Another big and an easy one. Stay away from soda or pop, depending on which part of your country it's from. It's definitely pop in my book. Staying away from this is going to decrease your risk factor for a ton of things. And then calories alone, taking those away, will greatly beneficial. One thing you can do instead of soda, Zevia is a good alternative, and they sell that in most stores right now. Red meats, processed meats can be inflammatory, margarine, shortening, or lard, and then also dairy. So again, it can be really hard, but it's also very simple. Just don't eat them, or very, very little. Anti-inflammatory foods. Here are 5 big ones. Tomatoes, definitely anti-inflammatory. Olive oil. Olive oil is a good one because you can put it in a ton of different things. You can cook with it. You can mix stuff in it. This is the big one. Green leafy vegetables, the most important one. Eat a ton of green leafy vegetables. It's going to be the best thing you can do. Instead of having bread on your sandwich, just eat it with green leafy vegetables. Spinach is great. Kale, collards, put them in smoothies. Awesome alternatives. Nuts, awesome, quick, healthy snack. Chock full of tons of vitamins and minerals, but then high in calories too at times, so you can get a lot of energy from that as well. Fatty fish is great when we're talking about meats. And then fruit. Strawberries, blueberries, cherries, and oranges all have a lot of anti-inflammatory properties and very beneficial for us. So make it as simple as we possibly can, because nutrition can be complicated. Eat less inflammatory foods, especially out of these 5. Eat more anti-inflammatory foods in this section. Now, one thing that you can do as well to supplement, because a lot of people have a hard time cooking, or maybe you're still on the go and you're still working. Daily meal is a great meal replacement. It has a ton of vitamins and minerals in here. Think of it as like its own multivitamin, chock full of protein. It has fat in it, the good kind of fat, and no sugar in here. This stuff is amazing. It has an amino acid profile, so your branched chain amino acids are in here. One of the best one that I can find. That's why we sell it. That's why we use it. So another alternative that you can have. So ultimately, eat better. It's going to help with almost everything, especially decrease our risk factors for having bad events happen if we do get COVID-19. So we are here for you. We are open. If you have any questions, click the button below. It pops it up right to a direct Facebook message with Inver Chiropractic. I'll answer. My wife will answer. Dr. Austin will answer, or one of our staff members. So if you have any questions, please ask below. If you feel like this is good information and you want to share it, please do so others can see. Otherwise, we love you. We look forward to seeing you guys in the office, and have a good night. Thanks.